Good afternoon and welcome to the Hospitals of Providence Physician Care Chat. My name is Rob Anderson. I'm the CEO here at Memorial Campus, and we are joined today by Dr. Carmona, a new general surgeon to El Paso. Today we're going to talk about robotic surgery and what that means to you, what that means to us, because the Hospitals of Providence has the largest footprint in robotic surgical volume and surgical cases. And today excited to meet Dr. Carmona. Dr. Carmona, tell me a little bit about yourself.
Thanks, Rob. So I'm Jorge Carmona. I grew up in Puerto Rico. I trained in medical school there and decided to come to the States to be trained in general surgery. I did my training over in Michigan, over in Detroit at the Detroit Medical Center and Wayne State University. After that, I practiced general surgery in Oklahoma for 4.5 years. And now I'm here in El Paso almost a year in.
So what do you think about it so far? What do you think about El Paso?
Oh, love it. Love it. It's a big, small city. People are great. It's lovely.
It's a great community, and we're glad you're here too with just your expertise in general surgery and really robotics. And so, you know, when you think about robotics, explain to the individuals, the community, when it says robotics, what does that mean?
So basically what it means, and there's a lot of confusion out there, people think that a robot is actually doing a surgery. It's not, it's just another tool. So when we do robotic surgeries, there's two components of it. There's a console where I'm at and I'm actually manipulating the arms of the robot, which is really what it is. It gives you much better visualization and keeps everything in a minimally invasive setting. So, and that comes with all the advantages versus doing an old-fashioned open surgery.
Yeah, and so you said the word, minimally invasive. For those that, may be contemplating a surgery, right, or needing a surgery. When it says minimally invasive, what does that mean?
So, in general, what it means is the smallest amount of incisions to be able to perform a full surgery. And this goes from something like a gallbladder, but it can go as far as having part of your colon removed, part of your bowel removed, major hernia surgeries that once, several years ago would have been a big open surgery. Now you can actually do it as an outpatient, minimally invasive setting.
And so the old school way of doing surgical cases is you said, the open route, right? Which I think a lot of folks are probably understanding what an open surgical case is. So, as a patient comes in to see you, right, they say they need a gallbladder removed. What do you tell them about the differences between I'm gonna have do an open case versus a robotic case?
Well, so yes, it's for something like a gallbladder, for example, instead of having an incision 6-7 inches long in your belly, doing it the old-fashioned way, then it's 4 little tiny incisions that most people don't have that much pain. Most people don't even go through their whole narcotic prescriptions. It's very well tolerated. They can continue living their life as normal as it can after having a major surgery.
And so what do you think the benefits are of doing robotic surgical procedures on individuals? What are the why?
So when it comes to the benefits of it, there's several aspects. It starts with the pain. Again, most people are back to normal faster than an open surgery, especially when it comes to bigger procedures, bigger hernia repairs, bowel resections, things like that. The pain is much less. It's much better.
Okay.
Much well tolerated. They require less narcotics. Some people feel that they're back to themselves quicker versus a big open surgery. Obviously, there's also the aesthetics aspects of it. Smaller incisions can be hit high.
Right, you're talking about the smaller incision versus here, right?
Correct. We're talking about 8 millimeter incisions versus an incision this long. So it's something considerable.
Yeah, and so you mentioned it before, you've got a console, right? You're at a console, and then there's a robotic arms that are literally look like arms that go into the patient. Kind of walk us through what that is, and then how that incision really is versus the knife.
Right. So to be able to operate with the robot, you need instruments to attach the patient and the robot. So we use little tiny incisions. They're basically 8 millimeters, and then we put our instruments in, and that way the robot is what we call dock into the patient, and then I go into the console, and then I'm able to operate and do the entire operation from the console as much as possible. And the visualization is outstanding even when compared to laparoscopic surgery. But even in open, when compared to an open fashion, I can go deep in areas that open surgery is really difficult.
And so when you say visualization, that's for you, so you can be a little more precise, a little
Correct.
more clear that you've got it all, you've done the full procedure at the best of the ability. Right?
Correct. Especially when we're talking about in areas, for example, very down deep in the pelvis, around the rectum, or actually very high up around the esophagus. That's where the robot shines.
And so we've got robotic, the technology here and at all of our hospitals, and we do anything from GYN surgeries, gynecological, OB-GYNs, and urologist. And so, as you as a surgeon, why did you choose to go the robotic route?
So because of all the benefits that we talked about before, the better length of stay, the better pain control, faster recovery times, feeling back to normal, that was my priority, especially when it comes to the pain control. Back in the day, the robots were designed, as you mentioned, mostly for the gynecological world, for the urological world. But now with the newer robots, it opened the general surgery world. And now we can basically do almost any procedure that we do open, we can basically do it in a minimally invasive way.
And so those patients that are contemplating it now and may have another surgeon that may not do robotics, what's your advice to them to get educated on the robotic procedure?
To the patient?
To the patient.
Yes, absolutely. The more research you do, the better. And there's nothing wrong necessarily with an open procedure, but if that procedure can definitely be done in a minimally invasive way, I would say that that's a definite advantage. There's cases that minimally invasive procedure and robotic surgery are not appropriate, absolutely, but most cases you are able to.
And so some of these procedures, appendectomy, some are elective, meaning you need to get them out. Some are also emergent, right? A patient will come into an emergency room, have severe pain, and you need to get them to surgery pretty quick. Are those cases still okay to do on the robot?
Absolutely. That is a great question. Absolutely. And that has changed a lot in the past several years when if you come with a perforated ulcer, perforated colon, incarcerated hernias, historically those are open procedures. And the length of stay can go from a few days to a week. Now with minimally invasive surgery, the length of stay can be 1 or 2 days for something that was 5 days. And again, much less pain and recovery is faster that way.
It's super interesting, the new technologies, the new techniques that that the healthcare is advancing in. And so, for you as a surgeon, why'd you become a doctor?
You can ask my parents. I wanted to be a doctor since I was like 4, I think.
Okay.
I mean, I remember being in 2nd grade and everybody's like, what do you want to be? Doctor. For whatever reason, I mean, I do like patient interaction. Being able to help somebody with my hands and not having to wait for a medication to do his job and see you in 3 months. I like to be able to meet the patient and sometimes it's the worst day of their life. And you treat them well, you're able to do a surgery, you fix them. They're the most gracious people on earth. And I think that's what gets me to being a doctor and specifically being a surgeon.
And you have a family?
Correct. Yes, I have a wife and a 19-month-old son.
Okay, and so how's that changed your life as a surgeon?
Ooh, gotta make time for them. Gotta make sure you leave time for them while taking care of all the patients that need care. That is a difficult thing to do,
Right.
work-life balance, and especially when you're a surgeon that, again, you might be needed within the hour to save someone's life. So yes, it can be rough, but it's worth it.
Well, good. Well, Dr. Carmona, I want to thank you for your time here, and we appreciate you. Glad you're here in El Paso.
Thank you.
And, you know, the technologies, the new advancements that we're doing here, and the robotic surgical techniques that you have here are outstanding. So we thank you for being here.
Thank you.
And we thank you for joining us for the Physician Care Chat. Stay tuned for more.